Welcome to our November general meeting.
Okay, it's a little bit after 7, so let's go ahead and kick this meeting off. This is a November meeting of the Mountain Ski Patrol, our general meeting. And as you can kind of see our rough agenda there. So for, as we typically do, let's start off with good things that since our last meeting and last get together.
Yeah, Timberline was open Friday, Saturday, and Sunday. We had a good showing by MHSP, especially by our apprentice class. We had 8 different apprentices that dispatched across the 3 days and got some good practical experience and a nice day on the hill.
Good. Anything else? Anybody got anything else you want to comment on?
Just a quick chip in, Cleo, since I don't think Paul can be with us tonight, I didn't see him in attendance. We are off to a raging start with the spies. We had our first spy in our at OEC class last week. She made it just in time for the helicopter landing. And then we ran, I believe, 9 of the 11 spy through CPR on Saturday. So we're off to a great start with Mr. Van de Bosch.
Good.
Yeah, Cleo, just to mention, we got 2 of our rookies did their first day on the hill at Timberline on Saturday. So Nash and Emily did a great job up there.
Good. Wendy?
I was trying to clap and I thought I hit the wrong icon. I don't have my hand raised.
Oh, okay. All right. Well, thank you, Wendy, for all that you do, and especially this time of year, getting all the dispatch set up. Thank you very much. Okay, anything else for the good of the order for good things before we get going? Okay, so I think the next thing on the agenda is Dr. Murray and Nurse Kaylee to talk about the Providence Mountain Clinic. So Dr. Murray and Kaylee, the floor is yours.
Hi, yeah, so I'm Kaylee. I'm the nurse manager at the Mountain Clinic. I think Mike's on here too. First, I'd like to say thanks to all of you. You're all amazing, and thanks for all the hard work that you guys have been doing. And I'm really looking forward to another year. We can skip to the next slide. So as you all well know, we are the Providence Mountain Clinic. We provide high quality care to all of our patients. Our objective is to be able to provide definitive care for all of the patients that come up with any injury and then get them to the right place. So we are staffed with emergency room nurses and doctors, x-ray techs. We even have ultrasound up there. And we have registration. All of our registration people have a background in emergency medicine as well. They're x-ray techs, EMTs, CNAs, medical assistants, and CNAs. And a lot of them are actually going to nursing school as well. So we're pretty highly educated and ready to go. We are open when Mount Hood Meadows is open. So we are open when they have nights. We scale back when they go back to just days. Anything that changes, that's our hours of operation. So make sure that when you're calling and letting us know about a patient, that we're actually open and will be open when you send a patient up to us. You can also check the website at skihood.com for their hours of operations. And you can go to the next slide. So the basic injuries that we want you to send to us are like the single joint injuries, the knees, shoulders, wrists, ankles, elbows. Probably the patients that you don't want to send to us are the head injuries or the random family that comes up with the grandpa from wherever who falls and hurts himself with a lot of comorbidities. We probably, like, if we are really staffed for just these single joint injuries. We can do reductions, we have sedation, but really it's more for healthy people who have those kind of injuries. You can send like a simple UTI to us, or like an ear infection, maybe somebody that's very obviously has a strep throat. But again, with COVID, we've just been a little, we're trying to be really careful with bringing those patients into the clinic since we're just one big room with just 9 beds. We kind of try to keep the really sick people out of the clinic. Just call ahead if you have a patient. let us know that you're coming, what you're seeing, what's going on, what your thoughts are. I know that you guys are all highly trained as well. Your eyes, we really rely on your eyes and what's going on out there. So give us a call. You're always welcome to give us a call and consult with us and see what we think or where they should go. And then make sure the patient knows where they're going and that they're coming straight to us. And then also give us their phone number, and then ensure that the patient is NPO, just in case we have to do a sedation or something like that. And then next slide. So we're, like I said, available for consultation. We are not offering testing or vaccinations at this point in time. And if you can, please don't send us symptomatic patients with COVID-like symptoms. We're just not equipped for that kind of patient population, or like, anything majorly medical. Although having said that, we are, like one of the closest places that can offer some medical services to patients. But if you can get an ambulance to them sooner, that's probably the best way to go. If like they have like chest pain or stroke-like symptoms or something like that, they should probably just have an ambulance called. If hopefully that makes sense. I think that's it. If you want to go to the next slide. If you have any questions, this is the time where I'm happy to answer them. And I think Mike Murray is on as well.
Yeah, I'm on here. What I want to let everybody know is, we're perfectly fine with somebody with 2 extremity injuries.
Yeah.
You break both wrists, we can do that. What we don't want to see is people with things that are going to have to be transported to the hospital anyhow. So the patients with head injuries, patients with open fractures, patients with distal neurologic compromise, vascular or neurologic compromise, they should go somewhere else. Patients with abdominal trauma or significant thoracic trauma, they should go somewhere else. Kind of a nice rule of thumb is, if you're thinking that they're a patient who would be a good candidate to put into an ambulance, they're not a good candidate to come see us. We are not licensed as an ambulance receiving facility. Patients can instruct the ambulance to come to us, but that's not what they're going to do normally. And we really expect to have people show up in private vehicles and not in ambulances. When people do come over, probably the best idea is to have them park in the designated parking we have right outside of the clinic, and then call us on the phone. So we make sure that we're not overloaded at that point. If we have too many people or we need to clear out a bed, we can leave them in their car until we can make space available for them. So that's what you ought to let the people know. Really important that we get called ahead of time to make sure we're there. Really important that we have the patient's phone number, because patients go somewhere else. Really important that they don't stop for a pizza on the way over. They should be NPO and they should come straight over for us. So.
What does NPO stand for?
Oh, yeah, what I always tell people is I went to school for a long time so I can talk funny, and so I'm going to lord it all over everybody. It's nothing by mouth. It's Latin. So,
Okay. So everybody, this is a good time to, you can see the phone number on there, write down the phone number, put it in your cell phone so that you've got it for whatever reason, but this is a good time to get that number down. And then I saw hands up from Mike Anderson, and I thought then Matt Wood.
How about like stitches? Someone ski edge slices their leg or hand or something like that, or just normal stitches, not traumatic injuries.
Yeah, the vast majority of lacerations, we're going to be able to close them without any problem. They represent about 10% of our business. I have seen lacerations that are big enough that they end up going to the OR. That happens, I don't know, about once every year or two. But if they're not gigantic, most of the time we can close them. And even very large ones, we occasionally, on an irregular basis, have orthopedic surgeons that are on site for on-site consultation. So I've called them in for lacerations that were down through the gastroc muscle and the calf and things like that. So yeah, lacerations is big part of our business. Unfortunately, the other 10% of our business is people with head injuries. And so we see a lot of those, but it probably doesn't make a whole lot of sense to send one to us because even though most of them we're going to just observe and then send them home, what you're really trying to decide is which ones need to get a CT scan of their head and which ones can go home. And it really makes more sense for them to go to a place that has a CT. We do not have a CT. So.
And I was going to say, we also have a tetanus shot. So anybody who has a laceration, we're able to offer a tetanus shot, or if they need a tetanus shot, we can do that.
Okay, Matt Wood, do you still have your hand up?
Our current apprentices on the call tonight. And maybe some of the hosts aren't familiar with nil paras, non paras, nothing by mouth. So if, yeah, as Kaylee and the doc said, if they have to provide any sedation, we don't want them to vomit anything up if they're under sedation. So yeah, no, no 6-packs and pizzas on the way to the clinic.
Wendy, is your hand still up or you're trying to?
Yeah, it's for real this time.
Okay.
Question about insurance. If our patients are afraid to go over there because their plan, they're not on a Providence plan, does that matter?
We see anybody who comes in the door, regardless of their means of payment. So we'll still see the patients. Whether they're in network or out of network is going to be something they're going to have to figure out with their own insurance company. The other thing that a lot of people ask is how much is it going to cost? And that's something that we just don't have a mechanism for sorting out. I could go on for an hour or so about that subject, but we aren't going to be able to give people estimates before they come over. Despite what the New York Times wrote in an article, it's been my experience that the people at Providence are real good at working with people to figure out how they're going to make payment, even if they don't have any means of payment or they got the wrong insurance or something like that. So we'll see people. Another thing that's that is probably important in this area is the patients who have Kaiser. We're not a Kaiser facility, but we're outside of Kaiser's geographic limits. So generally Kaiser reimburses us pretty well. So Kaiser patients, you can feel free to send them to us. Don't guarantee that Kaiser is going to pay for it. That's not our problem, but it's a good chance they will.
Any other questions for Dr. Murray or Kaylee?
I'd like to say whenever you send someone over to the clinic, it would be nice to send as much paperwork that you've done with the patient. It will help speed up things on the patrols end and also on check-in on when someone comes into the clinic, especially if we're really busy.
That's very true.
If you can send the IRF with the patient, you know, the admitting can just copy that stuff off, and the patrol can basically copy the IRF, so that'll be useful.
Thank you. Yeah, it's pretty much the same for all areas, so it would really help us when a patient comes in. Yeah, thank you.
Anybody else got any questions, comments? So I do have a question, Dr. Murray. We've had a lot of discussion over the last several months about opioid overdoses and the use of Narcan. Do you have Narcan available in the clinic there?
Yeah. we got buckets of Narcan.
Okay.
I mean, it's pretty much essential since we're treating people with opioids fairly frequently. Actually, we use a whole lot of fentanyl, which I hope we're going to continue to be able to do despite all the bad things in the press. What I keep telling people is fentanyl is a great drug as long as you don't mix it with your heroin. So we do have Narcan there. There's also the issue that in the state of Oregon, pretty much anybody can get access to Narcan. And I believe it's pretty similar to how you do the access to epinephrine. You take a short course and then you can buy the nasally administered Narcan. And I think that's something to consider. Now, I've been up there since 1984, and I have yet to see a narcotic overdose at the clinic. So it's not a real common thing, but I have seen housekeeping staff who've had needle stick injuries and other things. There's definitely people that are using narcotics there.
Okay, thank you. Anybody else? Any questions, comments? Kaylee, Dr. Murray, thank you very much for taking your time to be with us.
Thank you.
No problem.
We're going to continue with our meeting, and you're welcome to stick around. And hopefully we'll see you on the mountain.
Well, actually, hopefully you don't see me on the mountain unless you're working.
Well, that's kind of what I meant.
Okay. All right. Thanks.
Thank you. Okay, it looks like the next thing on the agenda is Katie. Are you here, Katie? You with us?
I'm here. Thanks, Cleo. Hi, everyone. For those of you who don't know me, my name's Katie. I've been a member of MHSP for the last 3 years. And for my master's thesis project, I gave a survey to MHSP back in February this year. So some of you may remember seeing that email. Today, I'm going to be sharing the results of that. Please feel free to use the raise hand function throughout if you have any questions as I go along. Let me go to the next slide, please. So why did I choose to study ski patrollers? Well, since I'm a somewhat new patroller, one of the first things I started to notice when I started patrolling was that the folks who join this organization are amazing people. We are voluntarily doing an important job that sometimes results in us witnessing or experiencing very serious cases at times. So I thought that this group of folks must have some kind of traits that make us capable, resilient, and up to the task. So I got curious about this, but I was unable to find any published studies looking at ski patrollers. So I decided to do my own. Given the important work that we do, we are considered to be first responders to sometimes traumatic cases. And we know from studies in other first responder populations, such as law enforcement, EMTs, paramedics, that the reported prevalence rates of PTSD and burnout are significantly higher than in the general population. So I decided to survey you wonderful folks to see if I could measure some personality traits that may be associated with how we experience outcomes from helping others. Go to the next one. Thank you. So the first variables that I was looking at are variables that are the outcomes that can come from the work in which we are helping others. So the first side is compassion satisfaction, and these are the positive outcomes from helping. I'm sure we can all easily bring to mind a time when we felt proud of the work that we do, or we felt that we were truly making a difference. And the other side would be compassion fatigue. So those are the more detrimental impacts that can sometimes come from helping others. And we break that down into two elements. The first is burnout, which is those experiences of feeling exhausted, feeling cynical, feeling like the work isn't making a difference anymore, or having a reduced ability to do the work. And then the other part is secondary traumatic stress, which are experiences that can come from helping others through a traumatic event in which the helper actually takes on some of that trauma. So you might see things like sleep problems, having images of the event coming back, or avoiding reminders of the event, those kind of things. So those are the first few variables. And the next ones are personality traits. So I was curious about how we as patrollers are experiencing those outcomes from helping others, but what are the factors that may impact how those outcomes present? Do we have things that are making us protected? So these are the big 5 personality traits that tend to encompass the wide range of human personality. So I'll briefly just define each of them. First, openness is acceptance of new ideas and ways of living. Conscientiousness is having a high capacity for attention to detail and regulating your behavior. Extroversion is having enthusiasm, optimism, seeking social engagement. Agreeableness is having a high level of trustworthiness, helpfulness, and cooperation. And neuroticism is associated with kind of those negative states like anger, anxiety, depression. And people may have a reduced ability to cope with stress with neuroticism. So first, if you can go to the next slide, I have our demographics. So there was a wide range of member representation, which I was really excited about in all the various roles of MHSP. You have the gender identities and ages there. Race is not reported here due to limitations to anonymity. You can see the kind of the makeup there. We can go on to the next slide. So I asked the survey takers whether they had witnessed or experienced a traumatic event while patrolling. I also asked whether they had experienced or witnessed a traumatic event outside of patrol in another occupation, knowing that a lot of us are in the helping professions in our day jobs as well. So the majority of patrollers did say that they had experienced or witnessed an event on patrol at 60.2% and outside of patrol as well at 69.3%.
Katie, can I ask you a question here?
Yeah, go ahead.
When you asked that question on the survey, I thought I remember the question was stated in the past year. Is that correct? Or was it forever?
This one was forever, yeah.
Okay.
Some of the questions were asking about the last 30 days, but this one was overall time.
Okay.
Thanks, Leo. And we can move on to the next slide. So how did we land in terms of these outcomes from helping? So it looks like most MHSP members scored in the low range for secondary traumatic stress and burnout, those elements of compassion fatigue. You can see in the slightly lighter colored bar on those two that some people did score in the moderate range for those scores. So there is a little bit of that experience here, but not a whole lot. For compassion satisfaction, most participants scored in the high range. So a lot of compassion satisfaction with some in the moderate and one in the low range for compassion satisfaction. So it would seem that even though the majority of us reported witnessing or experiencing a traumatic event, in general, we're doing pretty well on these outcomes. There were some folks that scored in the moderate range, which is notable, shouldn't be discounted. And it's important to note that there are some limitations with this information. So first, we did use self-report. So there's always some potential for bias there. Sometimes as humans, we want to portray ourselves in the best way possible. So that can introduce bias into surveys. Sometimes as folks sometimes choose answers that align with how they would like to be perceived versus how they really feel, which may or may not be the case here. Another important bias to consider is that only current members were surveyed, which means that anyone who has left the patrol and is no longer on our listserv is not receiving the survey. So if there are any folks who have left the patrol due to secondary traumatic stress or burnout, they did not answer the questions. So we don't have their data, unfortunately, but it is interesting. And then we can go on to the next slide for the main study results. So there were some associations between the personality traits and those outcomes. So as you can see, all of the boxes that are colored in blue show a significant association, either positive or negative. So if it's negative, that means that, for example, as folks scored more highly on neuroticism, they tended to score more low on compassion satisfaction. And that association is negative. Similarly, folks that scored higher on neuroticism tended to score higher on burnout and secondary traumatic stress. So you can see those associations there. There were quite a few that were significant, except for the trait of openness for some reason. So it's important to note that these are associations, they're correlations. So we don't know for certain if someone having high neuroticism is actually what's causing them to have more burnout, but these two things are tending to show up together. So this suggests that it's possible that some of these traits are protective against the impacts of helping others who are experiencing trauma. And given that we have kind of those low rates of burnout and secondary traumatic stress, it could be that we have some traits that impact our resilience. However, this is just a correlation. So we'd need to do more studies to see if there is actually evidence that these are causing each other. But this is a good place to start. And all of these results were aligned with research in other populations, such as firefighters and ER nurses, so similar kind of first responders. And we can go on to the next slide for the numbers in case anyone's interested in looking at that. I'll skip past that for now though, but it's there if you would like to see. And we can go to the next slide, please. So what can we do with this information? This was the first study to examine outcomes in ski patrollers at all that I could find, which is really exciting for us. And it's an opportunity to start a conversation. So other studies in first responder populations have shown that first responders report having some deficits in knowledge about signs and symptoms of traumatic stress. Some first responders have also reported perceiving some kind of a cultural stigma against speaking out against mental health. Again, ski patrollers have not been included in research to date. So this is not necessarily representative of us, but we are first responders. So I felt like it was relevant to start this conversation, given that we do respond to serious cases. So on the next slide, I decided to give you all some signs and symptoms of compassion fatigue. So we learn about the signs and symptoms of traumatic injuries and OEC for our patients. So we can also think about these topics in terms of that language to check in for ourselves and others. So we have secondary traumatic stress and burnout, those two terms that you know from the literature we just talked about. And I'll just leave this up for a couple of seconds while you peruse, but feel free to look at the slides in more detail later on. And I'll present it in a little bit of a different way in a moment as well. And then we can go to the next slide too for some other notes on how we can prevent compassion fatigue. So this is a stress continuum that's created by some patrollers who are doing some work that's really amazing in this topic. This is a tool that can be used for different purposes. So it can be used for checking in with yourself. It can be used for checking in with team members. And it goes on the scale from green to red. So each category has some kind of descriptors underneath it that describe what it would mean to be in the red or to be in the green. And it might be a nice tool to kind of see where you're coming into a shift. For example, if someone's coming in feeling really orange today, like they are having some trouble, whether it's outside of patrol or inside of patrol, maybe there's some accommodations like having additional breaks or having some kind of extra social support or check-in. So this tool can also be used after a case too, in the days, weeks, and months following to see how folks are tracking if they were responders to a significant case. So I wanted to show that tool as something that I thought was really awesome. You can go to the next one. Some other kind of notes to look out for, increase in substance use or difficulty performing tasks in your day-to-day job outside of patrol too. Sometimes these things can kind of get traveled over into our day jobs and impacts on personal relationships as well. So feeling less connected or having a hard time communicating, those are some things to think about. And on the next slide, I have what we can do about these things. So again, checking in with yourself, checking in with your team members, making it normal to talk about these things, making it normal to check in, see how everyone's doing, being knowledgeable about the signs and symptoms, like you all have a little bit of that at this point, and having extra check-ins after a significant case, knowing that it's okay to not be okay. We know that the prevalence of traumatic stress is high in first responders, so having a reaction to a big case is actually quite normal and to be expected for some folks. And also kind of knowing your boundaries, so knowing if you are in the red or the orange on a given day, what are some precautions that you can take in terms of, do I need to take more breaks or do I need to let people know where I'm at? If this is kind of bringing up a lot for anyone and you feel like yourself or a friend may be experiencing some of these things, some things to note are noticing is the first step. You're already kind of on the path if you are thinking about this and thinking it might be relevant to you. Consider confiding in a trusted friend or partner or other support system. So if it's your friend who you're concerned about, letting them know you care about them and are concerned. If it seems like too much to actually approach someone that you know, like a friend or a support system, there are talk and text lines available that have anonymous first responders on the other end who you could text and just check in with if you feel like you would prefer to have a no strings attached kind of check-in. Considering a break or a shift in responsibilities as well, and accessing resources. So on the next slide, I have a ton of resources for you to peruse if you would like to refer back to this. There is some information in general for learning more about this topic. I also have some talk and text hotlines I just mentioned, and then some resources for accessing professional support as well. There are a number of mental health clinics that specialize in helping first responders in the Portland area as well as Vancouver. And so I encourage you to check those out. There's also some financial assistance programs that will pay for you to actually access that help. And I'm also here as a peer resource for anyone who would like to talk, or if you need help accessing these things or navigating these systems that can sometimes be difficult to navigate. My email was on the first slide, and you're also welcome to approach me on the Hill or anytime you see me at patrol events. So we can go to the last one there. I just want to quickly acknowledge a few people who really helped make this happen. My thesis advisor, Dr. Christensen, she will be joining me for a more in-depth lecture on this topic with the OEC class in January. So if you are itching to know more, you can feel free to attend that, maybe join in for some scenarios afterwards. And then Matt Wood was instrumental in learning how to get the study approved and distributing the survey. So thank you, Matt, for your help. And of course, the council for allowing me to delve into this topic, and all the patrollers, ski patrol hosts, everyone for all the work that you do, and everyone who is able to participate. So thank you all for your time, and I'm happy to answer any questions if there are any. Yeah, Mike.
Yeah, I would kind of suggest, since we are a volunteer organization, I mean, if somebody is facing burnout, I mean, I've done this with other organizations, they tend to just kind of drop out. And so my suggestion would be is maybe looking at the members we've lost in the last 5 years to see if you could do a supplementary poll to see if any of those folks have dropped out because they felt burnout. I know we've had COVID in the middle and all that kind of stuff, but I think the difference between us and some of those other professions is they are professions where people are earning their livelihood, right? And so they're less likely just to leave. We're in a volunteer organization. If you're hitting burnout or PTSD over something like that, you may just tend to drop out of the organization.
Yeah, that's a really good point. And I think it was a huge limitation to my study. I think surveying past patrollers and also maybe having some kind of an exit interview would be a great way to capture some of those folks. Thanks, Mike.
Anybody else have any questions or comments for Katie?
Just a comment, Katie, this is just really fabulous. We're privileged that you chose this organization to research. And I just sent in the chat that we need to get you on the docket at the PNWD convention next summer as a presenter.
Yeah, that would be wonderful. I've been talking with Jody Jeffers a little bit about some of that work. So yeah.
So I just want everybody to know that if you or someone that you know on the patrol is involved in a traumatic incident, whether it be a serious injury or an injury to a fellow patroller, a child, your family, or maybe even a death incident, and you want any kind of assistance, feel free to reach out to any of the council members or now to Katie. We do have some resources that we can help you with. We have worked with the local sheriff's offices in the metro area who have provided us in the past with critical incident stress debriefings. So those things are available. So if you're involved in something that is kind of bugging you, reach out to somebody either on the council or Katie or a friend. Just don't bottle it up and not talk about it. So there are resources out there that we can refer you to and help you out. Thanks, Katie.
Thank you all. Thanks, Cleo.
Okay, looks like on the next slide, looks like Snovana, and I believe that goes to Jan Szilagyi.
Yes, thank you very much. thanks so much, everybody, for responding to the information that I put in the sweep that came out last week. We had some holes that needed to be filled, and we've been seeing response. The Snovana show is this weekend. Thursday is simply a setup day. And I did say in the sweep that the setup shift on Thursday from beginning at 1 o'clock was full. You know, life throws a bump in the road once in a while though, and we did have 2 people who at short notice needed to pull off that shift. So we do have a couple of slots open on it if you need to, or you desire to help out the event and our fundraising efforts. That might be a spot for you there. The tear down shift on Sunday, just as an overview, we have a lovely partnership with Fish Productions, who owns the Snovana show. And in exchange for providing people to help set up the swap in the event on Thursday before the show opens, and then tearing it down on Sunday evening after the doors closed, we are benefited greatly by that sweat equity. Our booth fee, which is about a $400 fee, is compensated for us. We are provided with electricity without a cost, which usually runs about $140. I don't recall what the price tag is on Wi-Fi, but we receive that also, which is critical for us to be able to do our snow park pass sales. So, you know, over $600 in fees is being comped to us. And then on top of it, they donate to us $2,000 cash. So those 2 shifts are really important. So if you've got a little time on Thursday at 1 o'clock, we could use a couple more people there. When I sent the article in the sweep last week, we had 1 individual on the teardown shift at 4 o'clock on Sunday. We now have 5 people in there, which is great, but we could use 3 or 4 more. The more people that are on that shift, the quicker that shift goes. When we have a nice full group, about 8 or 9 people, they're finished in about an hour and a half, and that's wonderful. So during the show hours, we have both of our shifts on Friday full. Thank you very much. That's terrific. Saturday morning's shift starting at 10:30 to 3 is full. And now the evening shift on Saturday from 3 to 7:30 is full because people responded to the article last week. So that's fantastic. So it's basically the setup and the tear down of the swap, behind the scenes, no exposure to the public, where we are looking for a little bit more help. So if you've got some time this weekend that you can contribute to this, this is our biggest fundraiser in one fell swoop in the year. We purchased 1,800 snow park permits this year. Our profit on those is $5 a snow park. So we have a potential to earn $9,000. We've already begun selling them. We want to sell the rest of them out at that event next weekend and be in a need to have to purchase more to sell. That's about all in terms of a review for it. One thing I would mention is that if you're on a morning shift during the show, you can stay at the show after your shift is finished and shop and enjoy the events and the movies. If you are coming into an afternoon shift, you can arrive early so that you can do the same kind of thing. So you do have a nice little benefit there that you can do some shopping without having to pay an entrance fee. Anybody have any questions that I could answer for you about Snovana? Great, thank you so much for the time. And again, thanks to all of you who have responded and helped us get this docket full. Appreciate it.
So I just want to give Jan kudos. Jan has been helping us with these shows for as long as I can remember, a number of years. She's helped to coordinate these things, which is a lot of work behind the scenes. And I appreciate you doing that, Jan, and hopefully you continue doing it for us.
Thank you. I enjoy getting it all organized.
Britt Anderson, are you on this call in the meeting?
Britt said that he wasn't sure that he'd be able to attend, so he said he put everything in the slide that needed to go into the slide.
For the last, for about 3 or 4 years, we've been having a December, instead of having a general meeting in December, we've had our meeting at a social place and just made it a social gathering. And I believe we missed a couple of years because of COVID. So now we're back on, and Britt Anderson, I asked Britt if he would try to organize this and find a place. So it looks like I think he's leaning towards a Lucky Lab. I don't know exactly which one, but that's one of them he's leaning towards. And it's he's trying to organize a place where we can get a set amount, a set fee or money for food to be provided, and then there would be a cash bar to buy alcohol. In the past, this has been a really good event, kind of a fun event. So I encourage you to put it on your calendar for December 12th. The location and cost is going to be determined in the next week or so. And if you have questions or if you want to help Britt in any way, you can see Britt's email there at the bottom. So questions, comments, or those of you who've organized this in the past, any other suggestions for us?
Wear a really ugly sweater.
Is that the Lucky Lab on Hawthorne?
I don't know which Lucky Lab he's talking about.
Yeah, because there's
I
two.
think he was leaning towards Lucky Lab on Quimby. That's the one we've done it at. We did that 3 years ago, 4 years ago.
Okay.
It's a good location.
Okay, so please put that on your calendar. Plan to attend. I guess if you have an ugly sweater, wear it. Okay, let's go to the next slide, please. Matt.
Good evening, everybody. Just really quick update. First bullet, pretty self-explanatory. Do everything you can to stay healthy. COVID obviously isn't over. We're into cold and flu season. So if you are of a mind to, get your bivalent booster. If you haven't done that, get your flu shot at the same time. CDC is recommending that. Make sure that we stay healthy prior to and getting on the hill. One bullet that isn't in here, we are done with refreshers. We refreshed a little bit over 200 people in total, instructors and our patrollers, and about 11 visiting patrollers. So that went really well, including a supplemental to include vax optional. Thanks again to Johnny Lacey. I don't think that Johnny's on the call, but thanks for making that space available to us. Upcoming events, Saturday, December 10th, that's a C-Team day, possibly the first real C-Team day. We're going to be doing we're going back to the tradition of an all-day OEC class so that the apprentices get to see applied OEC skills in the snow, what it's like to have the possibility of an O2 bottle roll away from you on the snow or bandages blow away. Should be a good time. Need as many assistants and patients as we can get. We're going to muster at the Bowman Center between 7:30, get going at Summit. And then I will have crock pots of everything from heavy vegan to heavy meat following at BC. There'll probably be leftovers for teams if we're back in teams. Sorry, thank you, Bruce. That's A-Team day. I'm all mixed up. So yeah, if you're available, if you're free from a team day, please join us. It'd be great to have patients, it'd be great to have people who are really knowledgeable about plan roles. Then OEC class, again, still every Tuesday night. Come play patient, check in, refresh your skills, throw down, help out. We just had an all-day class on Saturday. We are really starting to ramp into scenario practice, starting to get them ready for finals. So we're at a point where we need patients. So if I get a handful, 5, 6 patients every Tuesday night, that'd be great. That's at Ida B. Wells High School, Southwest Vermont. And then the really big night, actually 2 big nights, because we've got a big group. We've got 32 apprentices. We're going to split the practical finals, their practical scenario finals into 2, Tuesday, January 10th and Thursday, January 12th. 2023. Again, we need patrollers to be second and third pair of hands. We need patrollers or hosts or just about anybody to play patient. So again, that's going to be at Ida B. Wells. Those the finals are going to run from 6 till about 10. We should be able to get everybody through that. So that is it for me. Thanks, everybody.
Okay. All right. Courtney, do we know how many people are on so far tonight?
62.
62.
Yeah, we had 65 at one point, but we must be boring.
We weren't the main audience or the main presenters. So once
Yeah.
the main show stopped, yeah, start dropping. Okay. Friendly reminder, pass the word, make the plug here for our monthly update to our members, being the sweep. There's a lot of folks out there. I was one of them in the past who never looked at it unless I knew I had some type of training that was coming up. But there's a lot of information, a lot of stuff that goes down there that is really, really helpful. So please ask around, check in with the new guys, new gals, say, hey, do you know, did you catch that thing on the sweep this month about such and such? And if they say no, it's like, have you actually checked the sweep? And if they say no, it's like, okay, you know, it's one of the few things that we have that we put a lot of time in for the executive council to try and distillate all the information we have down into kind of a short, concise manner. It may not be short for some of you, but with all the stuff that's going on, we do try and make it as concise as possible. Please, please consider spreading the word and getting that out so that we can try and get almost everyone to look at it when it comes out or sometime during the month. Okay, with that being said, dues. You don't usually hear much from me except for when it's time to ante up. So it's past time to ante up. We have a good turnout so far. I forget what the numbers are, but we're up over, I think 130, 140. But we still have some out there that need to pay their dues. And I keep hearing some excuses, and I say excuses not derogatorily, but there's some excuses out there. Oh, I lost my password and I don't know how to log in, never logged into Wiki. I was like, well, ask some questions, ask around, and we'll get you on to Wiki so you can pay if you want to pay with your credit card or PayPal. We made it really easy. You just click in and it's done. So if you know somebody that has problems, that has a ski patrol number, we can get them into our Wiki site to pay on PayPal. And of course, we'll also take checks. And if you only are able to use cash, let me know and I'll work something out to help you out with that. Let's see. Anything else to bring up? Yeah, so just a heads up, I'm getting close. Next year is my, if I'm elected, it'll be my last year that I can support in the treasurer position. So I should really start shadowing someone with me so that I can go over the like the budget cycle and the budget process, which is like first thing, day one running into election cycle. We have to start working on budget to get that done and agreed upon within about a 2-month period. So that's one of the biggest things, and it's really hard to near impossible to try and take that on as a newly elected treasurer without some background and experience in it. So if you are interested and or know somebody else that might be interested, please pass their name along, have them give me a holler, shoot me an email. Love to kind of give them the ins and outs, tell them what they might be getting into. But it gives you a wonderful opportunity, not only to work with the job, a lot of numbers and arrangements and coordinations with different suppliers, vendors, and whatnot, but you get to meet, check in with, and discuss things with a lot of our members that we don't normally get to do in a day-to-day role. And also, we have a great team on the council. So far, it's been with my time. I've only served on the council in this one position. It's been amazing, and that's probably been the most rewarding thing. So think about that. If you think you got a great team to work with on the mountain, you have a better team even to work with on the council to go and work through easy and difficult tasks. And it's been a wonderful experience. So think about that. Give me a holler if you're interested. So it's not something that we're struggling around at the last moment trying to find somebody, and we can make a nice smooth transition and make it easy for the person stepping up to it. So plenty of notice. This is let's see, a year and a half out. So spread the word, and we'll do what we can to help with this. It does take, probably has some of the most intensive coordinating efforts between banks, all of our different, what do you call them, applications that have to be transferred over, and knowledge transfer between QuickBooks, PayPal, bank stuff, online stuff for the bank, and many other things. There's about 20 different things that go on with coordination with different agencies like Secretary of State and whatnot. So let me help you help the organization and make it a good transition. So with that being said, I'll go into fiscal updates. I was miss last brief. I was swamped, so I didn't get the budget update. So we'll go to the next slide. Trying to portray here a difference between the approved budget and that spent for last year. So the budget is in the blue. The spent is in the orangish, showing you the difference between each for the major groups of what constitutes our budget groups, mostly through our senior leaders, being like the patrol chief, the directors, and the admin buildings support. So you can see that we were underspent to plan last year. Some of that was because some of the expenses actually rolled over into this year, just the way with COVID changes and plans and whatnot. So that was part of it. Most of it we were underspent just because we took a hard look at different things and didn't see a need to wrap those up as much as we thought we would have in the budget to actually spend for the needs. So which is good, because what we've seen this year, most of our expenses are going to go up. And I'll leave here for a second. And if anybody wants to ask a question about what this graph chart is trying to depict, give me a holler. I will look around for any raised hands. The gray line is actually showing the portion percent-wise of what would be considered an admin cost. So kind of broke down into the cost of putting Band-Aids on patients, the cost of training that goes into the real application of our mission. Other things like badges, plaques, awards, banquet, that's an admin cost. It really isn't, some would say it's critical, but most in the nonprofit world would say that that's an admin cost that supports the organization, but doesn't necessarily support our mission statement of providing help to the injured in the recreational footprint of the area that we serve. So you can see that on the buildings admin, almost 100% of that is considered admin. When you throw in like one of our biggest expenses is insurance, and then the banquet, it's hard to say that that's, even though we kind of are under the approach that the insurance costs are necessary to provide adequate protection for us and our organization, is still considered admin costs. So I'll leave it with this for a second. Does anybody have a question they want to throw up before I go to the next slide? Okay. Budget change. This is looking at the planned budget for last year and the planned budget for this year. You can see I want to say there's not a whole lot of change in income plan. Where we see most of the change is a little bit more money in the first aid chief for supplies and expenses in there. And then for the admin costs, we have prices that have increased from insurance, some building repair, awards. One of our longtime vendors went out of business about a year ago. And so we've had to pay for an increase in some of the pins and such, because of the supplier also own the dies for a lot of that. So things like that raise the price considerably for some of those when you look at a by piece cost. And then of course, like the banquet, which is has gone up a little bit because we're looking at the way that prices went up while we were trying to coordinate the banquet last year, and everything for hosting locations like this, the prices have gone up from last year to this year. So we're anticipating an increase for the same service. We're not really throwing in anything extra. As far as if you show up at the banquet, you're not necessarily going to get a goodies bag with a whole bunch of stuff that we're paying for. We're not doing stuff like that. It's just trying to provide the same, about the same as what we did last year, and hopefully with a few changes to make it a little bit more all around enjoyable time frame for people. So with that being said, any questions on this slide? It's dry, boring stuff, but it's here. Want to keep it out for the general use. So I'm going to go on to the next slide if nobody has anything. Okay, budget change. Try thinking about the best way to provide information that would show some of the changes. And what I wanted to look at was what we had for income and what we're planning for expenses for last year and this year. My screen's not showing the bottom, but if you look at the key code in the bottom, I believe blue is for last year's income, then orange would be for this year's planned income. And we see our expenses going up quite a bit. And this is against, can you tell me if that says planned on the bottom? I really can't see the blue. I don't know why, but I have the border. What is
The
Blue is
key-
Blue is actual.
Okay. So what I wanted to do here was show not planned, but the actual for what came in last year for income and expenses and the differences against the planned for this year. And what we see, what's highlighted here is we do have some higher costs with a couple of things mentioned, and where we have indicated, and your Mountain Hood Ski Patrol dues did not go up. In fact, they went down a little bit. What you see is that shows up in the delta, what we have to draw from our checking savings account that has built up over the years. And it's a planned drawdown so that we don't keep excess funds in our account. There's no need for it. And that's one of the reasons why we planned this year to have more expenses than income, why we lowered dues. And you can see that coming out as a delta for what we'll draw upon from our account. Any questions on this? And don't cut your fingers carving that pumpkin. All right, next slide. I think that might be it for me. Yep. All right. Thank you very much for your time, all your hard work, and look forward to seeing you out on the hill this year. Ciao.
Lee, thank you very much for all that you do. If we were paying for Lee's services, I'm thinking it would be in the thousands of dollars per month for everything that he does. So thank you very, very much, Lee. And Lee has put in some procedures in place over the last several years. So for the next treasurer, that should be fairly straightforward what needs to be done. And thank you, Lee, for getting that more organized.
Pleasure.
So Patrol
Most
Chief,
of the time.
looks like you're up.
Yeah, great recap, Lee. Lee's done a great job making sure that we all are thoughtful and conscientious about how we spend the money. So much appreciated. All right, I got a couple of slides First one, just a couple of dates coming up. By tomorrow, all of our team members should have their dispatch complete. That's at Timberline and Meadows and Ski Bowl. Next Tuesday, next week, we're going to open up dispatch for everyone else on patrol, all the supplementary slots. So go ahead starting on the 22nd and fill out your dispatch for the winter. And then December 3rd is the target first team day for all the ski areas. We had a note that Meadows might be earlier. And the snow last weekend didn't really come out the way we'd hoped. So it's probably still going to be on 12/3. We'll see. I'll have another slide coming up here in a minute. So just some
Hey, Dave.
Yeah.
Just to clarify, the actual first target team date for Ski Bowl is the week of the 10th and 11th.
Okay, gotcha. Yeah, and
it'd be lovely if we're starting on the 3rd, but the target date's the 10th and 11th.
Okay. I did see a note today also that Summit is targeting December 10th as an opening date. Okay, next slide. So just a couple of quick notes. I think most people know that Timberline was open this last weekend. They opened on Friday the 11th, Veterans Day, and stayed open through yesterday. The snowpack got skied down pretty well over the weekend. There was a couple rocks out there Friday. There was a lot yesterday. So Timberline made the decision to shut down after yesterday. So we'll hold on until there's more snow. Meadows website is still showing a possible preview day next weekend. So we'll sit tight and see about that. I think last I saw it was going to be just a couple of runs down close to the lodge. And this coming weekend, we are having a couple of events at Meadows. Cherryback for the team members is on Saturday the 19th, and the OEC refresher for the Meadows staff is on Sunday the 20th. There's a couple of our OEC instructors that'll be there. Okay. Big change at Timberline with the patrol director. I think a lot of you probably know this, but maybe not all. Libby has accepted a new position that she was offered at a company near Tillamook. She's working in the HR department with a focus on safety, and she's really excited about that new role for her. They will be moving down to the beach soon. They've actually already got a house down there, and they're driving back and forth now. I found out after Libby's last day that she had decided to make that last day be November 4th, which is behind us. So she won't be at Timberline anymore. The new patrol director is a name that I'm sure a lot of people here know, Brett Wesson, coming out of early retirement to take over again. His first day was this last Wednesday. And he spent the last week working with his paid staff. They did a whole bunch of training Friday, Saturday, and Sunday. And I guess the important takeaway here for everybody is that we'd like to plan a potluck event at the Bowman Center this coming Saturday evening, starting at about 5:30, as a send-off and a thank you to Libby. Libby, who started with Mount Hood Ski Patrol, she's been a great partner at Timberline for the last 5 years. One reason to do this at the Bowman Center, it's convenient to everybody. This will be the opportunity for the Timberline paid patrollers as well to say goodbye to Libby. So if you can attend, that would be great. We won't put this up on dispatch, but if you plan to attend, I'll put out a separate email. I would appreciate it if maybe you send me a note and say what you can bring, and we'll try to balance out the food options. And hopefully we have a good showing. I know Libby would really appreciate it. And I do hear a rumor from Libby, and she's working hard on this, that she's going to reactivate with MHSP and be doing volunteer shifts with us this year, and hopefully be joining one of our teams next year. All right, next slide. Most people probably remember that for the 2021 year, council voted to waive our minimum 8-day duty requirement on the Hill due to the pandemic, and we voted the same for the 21-22 patrol year. So for this coming year, 22-23, that starts next month, that 8-day minimum is back in effect. So we're looking for everybody that's an active patroller, and especially if you want to be an active patroller next year, 23-24, to make sure you get your 8-day minimum. You know, we're basically a 10-month operation, a year-round operation on the Hill, when you count in Timberline summer operations and Ski Bowl summer ops. So this is only about 1 day on the Hill every 5 to 6 weeks. So I think that's certainly the minimum that we could expect. The reason we have an 8-day minimum is so that our patrollers are competent when they get out on Hill and they've got a case, that they remember their skills, they remember the area protocols, and they can contribute. We won't know till the end of this year who made it and who didn't, so it'll really impact next year. If you have any questions or concerns for yourself, please send me a note. Thanks. Next slide. I had a couple other minor notes here. We did have a meeting in town on October 19th. There was all the ops leaders, the Hill captains, the associate supervisors, the training leaders. I really appreciate everybody showing up on a Wednesday night. Had a good discussion about the year coming up. Cleo gave the group a good discussion about feedback for folks, you know, maybe that are having issues with performance or conduct, and how leaders need to document that and hopefully coach our members correctly. A lot of you are probably aware that there's a land swap underway between the Forest Service and Meadows. Meadows is going to own a chunk of land, is the proposal, in a government camp, and they would be trading that to the Forest Service. They would get a chunk, the Forest Service would get a chunk of land over on the north side that Meadows owns. The update on that, Gordy has been doing some really good communications with Meadows on this. The plan that the Forest Service approved currently is under legal review. There's feedback, there's some environmental concerns from groups that are in the courts at this point. So Meadows expects at least 2 years, and it might kill the deal. It's a question mark on what's going to happen. So that is still a maybe, that Meadows will eventually be our landlord for the Bowman Center. But in the meantime, we're working with Meadows, and they're happy with some of the work we did outside on fire prevention. And for all of our Hill patrollers, we did have some difficulties the last 2 years, making sure everybody completed their OET refreshers. This was something we talked about at the ops leadership meeting in October. The OET coaches and the ITs are going to be working hard to put a new schedule in place so that all the team patrollers get checked off by January. That'll be on one of your team days. We'll have people there on your team day to do toboggan refreshers. If you're not there that day, make sure to schedule a different day. If you're not on a team, be looking for an opportunity. Contact myself or one of the OET coaches about when you can get your toboggan refresher. There's a number of clinics scheduled through the year where you can get it done. If you don't get your toboggan refresher done, then you won't be able to pull toboggans the next year. That's a significant liability issue. Okay, that's it.
Joel, can you talk about this work party?
Yes, had to find the unmute button. Carter had 36 hours of being wide awake on her last airplane flight back to the East Coast and asked that I do the update. First, thanks to Sam Lefebvre, Carl Hagan, Jay Kim, and me, and Carter for sure, and Mark Walsh for Stumptown Coffee. We got a lot done this weekend. Vacuumed, steam cleaned the oven, the fridge, the kitchen surfaces, and all the other surfaces throughout the building, the bathroom, showers, light, changed, I think all the light bulbs in there are now LEDs. Got rid of the metal conduit from outside the building, mopped the floors, took away the trash. I did some work on the HVAC. I covered up the vents upstairs completely, really well, and I think it helps. If you need a boot dryer, there are a couple of them in the furnace room. Otherwise, bring your own. Please don't take the covers off the vents upstairs to dry your clothes out. Give us a little time to see if this modification helps or not. You know, if somebody rips the covers off, we won't know whether it worked or not. Some of you who were around back when we did the ski swap will remember those H stands that we used for ski swap signs. I got 2 boxes of them if anybody has a need for them. Otherwise, they're going in the recycle probably in a week. If somebody wants them, they're yours to take. The only other thing, I'm still messing around with the thermostat with the HVAC. I changed the batteries in it. It seems to work all right. Sometimes it tells you it's not working, but it still seems to work. So if we aren't really successful with that, I'll run a 3rd wire for it and we'll make it the old-fashioned way instead of the new modern Google way. And that's, I think, all I've got on the work party.
Thank you, Joel. And thank you to everybody who helped with that. And if you have any, anybody has any questions about the Bowman Center, Carter Hubbard and Diana or the caretakers there, and Margaret Usher is the trustee that's responsible for the Bowman Center. So if you have any questions, direct your questions to one of those people. Next slide. Jan.
Thank you. It's so nice to let everybody know that several hosts are returning to us this season after 2 years of pandemic or being out of state for a short period of time or some injuries and things. It's wonderful to see some folks coming back into the fold for this season. The host dispatch is open today now, and we have our dispatch beginning for December 3rd at Timberline, possibly early on Thanksgiving Day, but right now it doesn't look like we're going to have the precipitation to support that. We have dispatch for Summit and Ski Bowl loaded beginning on the 17th. So we're ready to go. We have had our orientation for our apprentice class already, a day of training, which unfortunately we were going to have at Bowman 2 weeks ago or a week ago Saturday. And as you all know, that storm came in on Friday night and knocked the power out up there. So we ended up going to a Zoom meeting, but we are delighted to welcome into our membership this year, Donnie Gustafson, Annie Herbert, Spencer Hills, Christy, and Patrick James, who I think are online with us tonight. Christy Mize, Hyung Nam, Amy Ray, Andrew Robin, and John Waldham. This is a nice big apprentice class. We will be on the hill with them on December 3rd for their on-hill training day, where they will go to all 3 of the resorts that we volunteer at. So We're looking good. We're anxious to get started and really happy to have a nice big apprentice group joining our membership. Thank you, Cleo.
Okay, Laura or Derek, are you, either one of you on?
I'm here. Derek's here. I think Laura's not feeling well tonight. I don't think she's going to make it, but it's been nice. It's nice to see everybody and also hear all the positive news. And the DEI committee has some positive news, and we'd like to invite you to participate in our diversity, equity, and inclusion and assessment survey that we've spent the last 7 months putting together. It's been sent out. It was sent out at 7 o'clock, and some of you have gotten it already. And so if you check your email box, you might find it. If you don't have it by tomorrow morning, I know the slide here says by this evening, but if you don't have it by tomorrow morning, email us at the email that you see there, DEI@mounthoodskipatrol.org, and we'll get that resolved. But it's just going to take a little bit of time for everybody to get them. And so the purpose of the survey is to get a baseline of our experience in Mount Hood Ski Patrol, and it'll have 70 questions. We're going to have multiple choice as well as open-ended. The open-ended questions don't have a word limit. You can say what you want, and we invite people to take some time and share their feelings and experiences with us. It should take 15 to 20 minutes on average. We've tested it with a bunch of people. If you have more to say, it'll take a little bit longer, but that's about the average. There will be questions about your experiences on Mount Hood Ski Patrol relating to diversity, equity, inclusion, racial equity, gender equity, harassment, that should be harassment, I'm sorry, and discrimination. Only 2 people will see any of the data. It will all be unidentifiable, even to those 2 people. You'll also have the option to share your open-ended questions further if you'd like. There'll be options where you can say, I'd like to share it with the DEI committee, with the executive council, or with all of MHSP membership. We will send out some reminders, 2 reminders on November 28th and December 16th to complete your survey. And that's about it. We're excited that we're done with it, and we really are hoping to get all of you to take some time and share your thoughts and feelings about your time with Mount Hood Ski Patrol. So thank you. If you have any questions, I'm happy to answer. Oh, I did mean to mention one thing. It's going out to everybody that's active Mount Hood Ski Patrol, but it is not going to the apprentices. We may be developing a different survey for the apprentices to come out right before they finish and graduate. It's sort of an exit interview for the apprentices, but this survey is only going to active Mount Hood Ski Patrol.
Okay, any questions, comments for Derek? Thank you, Derek, and the committee that's worked on this for about 7 months now. You guys have done good work, and I appreciate all that hard work. And please, everybody that's on this call, please complete the survey. Okay. Nordic Director, John Fairgrave.
All right, good evening, everyone. So we finished our refresher training on October 29th and 30th. We got pretty much everybody through, so we're good to go there. As I've indicated, I think in the past, Teacup Nordic continues to expand its operations. In fact, I spent about 20 minutes this morning talking with their mountain manager, Jason Lemieux, and they're looking forward to working with us this season. They really like, us being there and assisting them. And, I think we have a really positive relationship with them. At this point, they don't have enough snow to run their groomer through the trails. They've actually packed down about 7.5 kilometers of trail, but only using a snowmobile, pulling something behind it. So at this point, they don't have any track laid or any of that sort of thing. So really have no solid idea of when they're looking at opening. They'd like to open as soon as possible, but they've got a lot of demand. Apparently there were a lot of people up there last weekend, even with that small amount of area that's packed. But I'll talk to Jason on Friday and we'll have perhaps a little bit better idea of what we're looking at in terms of opening. But we're in good position to be able to cover all of our shifts and work with them as we go into the year. That's all I've got, Cleo. Thank you.
Thanks, John. Next slide, please.
Okay, while you're doing that one, let me make our PNWD voting recommendations for the National Board. All of you saw the note, or hopefully saw the note from Kate and from Shelley recommending Liz Dodge, Mark Abend, Paul Keel, Maria Chan, and Dan Ayers. Several of us are a little less comfortable with Dan Ayers. We just as soon go with Liz, Marie, Mark, and Paul. That three of them are the current board members who work well together and will, I think, work very well both with the organization and with our new CEO. So that's our recommendation for the National Board elections. The other item tonight is the nominating committee. We are supposed to have a vote to accept the nominating committee in November. Now, the nominating committee selects people to run for the offices, for the MHSP offices. We do not make recommendations. What we do is to find people who are willing to run, who meet the minimum qualifications as spelled out in the, I forget whether it's the bylaws or PNPs, but the various offices have some minimum qualifications. And the nominating committee finds one or more people who are willing and able to run for those positions. And we're supposed to have at least 4 people, and I have 4. I'd be more than happy if anybody here wants to volunteer to have another person. But let me read off the names of the ones we have right now. Matt Ray, Heather Van Houten, Jim Stemple, and Sarah Draghi. So that makes our 4. It covers the hosts, and one of the jobs that we have to fill this year is host director. So because Jan is termed out. If anybody else would like to put in their hand now, we can take it later too, but if anybody right now wants to volunteer to be on the nominating committee, speak up. Otherwise, I'd like to have a motion and second to accept these folks by acclamation.
So moved.
And second.
Why don't you just call for opposed, Cleo?
So is there anybody opposed to Matt, Jim, Sarah, Heather, and Joel being a nominating committee? Is there anyone opposed to that? Going once, going twice, going 3 times. So that's our nominating committee. If you're interested in a council position, please contact one of these people or any current council member. Thank you, Joel, for getting that going. Okay, so anything else for the good of the order? Questions, comments for any of us? Any other questions or comments? Thank you all for getting almost all our training done. For all those who attended the OC refreshers. It looks like Lee has his hand up. I think that's Lee.
Yeah. Just a reminder, as one, this last week we celebrated Veterans Day. Some of you had time off. Hopefully that you all got a chance to offer your thanks and appreciation, pat on the back for somebody who has served. It's getting to be a harder and harder thing to work through with a lot of the changes that are going on in our nation. But there's been some amazing sacrifices for those that are no longer with us and those that are. And I believe we have several on the patrol that are. But if you likely have a neighbor or someone that you know, if you weren't able to this last week, it's never too late to go and say thanks, and you might be greeted with it's no big deal, like I usually did, and take it from somebody who has kind of understated things like this. It means a lot for somebody to come up and say something, and a lot of us who have served, there might be some embarrassment about it or some different feelings that go along with the time served, and just understand that. And whatever you do in giving thanks, it will return in ways you may not see. So if you know somebody, I just ask that if you haven't, like I said, it's never too late. And thanks for your time tonight.
Thanks, Lee. Any other questions, comments? Anything else for the good of the order for the meeting? So I'll go ahead and close the meeting. Who's got the keeper of the keys for the meeting?
That's me. Do you want me to pass it to you?
No. You did that last time. And
I'm going to stop recording and then we'll figure out who wants to take it, but y'all can chit chat. Who's going to stay the longest chit chatting? Then you get to be the host.
I say either give it to the vice president or the patrol chief.
Who's the chattier of those two? I wonder.
Kevin or Dave?
I hadn't planned on staying on.
How do you both?
Kevin's so
I'm
chatty.
an hour behind all of you. Yeah, you go, Matt. You take it.